Hi, this is Richard Morris.
This is Chance Pearson.
We are with the Metabolic Wellness Program. We want to take this time to thank you for taking your time and interest in our program. We're excited to show you what we've been up to this past 9 years. And to kick things off, let's introduce you to our program with a short video.
When the simple things in life become not so simple, it's time to pursue a solution. Susan had a hard time keeping up with the things that mattered most because of joint pain in her legs. So, Susan went to her doctor. Dr. Jones determined that physical therapy was the best course of action. He also explained that excess weight may be an underlying factor contributing to her problems. Luckily, Dr. Jones knew a solution: Metabolic Wellness, a program that works in conjunction with physical therapy to help patients lose weight and adopt a healthier lifestyle through simple nutrition and behavior changes. Susan was skeptical at first. She didn't want to pay extra money or waste time on another diet that was impossible to follow. But Dr. Jones explained that this program, developed by Chris and Heidi Powell from the hit TV show Extreme Weight Loss, was available to patients undergoing physical therapy. All it took was a few extra minutes per therapy visit. He also clarified that metabolic wellness was not a diet, but a program that invokes gradual changes: more water one week, an extra serving of vegetables the next, and makes it easier to adapt to a healthier lifestyle. Susan was still skeptical. Why would a physical therapy clinic have a weight loss program? Dr. Jones explained the reason therapists offer this program at their clinic is because they truly care and understand the need to treat the potential underlying root of your pain: excess weight. During the program, Susan received excellent physical therapy while also receiving friendly nutritional support and accountability from her wellness coach at each visit. Even better, Metabolic Wellness provided Susan with a downloadable coaching app designed to help her reach specific program goals. It was like having her own personal coach in her pocket. And even after graduating from physical therapy, Susan continued to receive ongoing coaching and support. Susan is now pain-free, full of confidence, and experiencing life fully transformed. Call now to find out if you qualify for the Metabolic Wellness Program and get started on the path to a healthy, happy life.
We created this video as a means to quickly and effectively explain our program. It's one of our favorite and most effective marketing tools. In our research, we found a few quotes that we love, and this is definitely one of them, and I want to read it here for you. Physical therapists are in a position in which they can positively impact the obesity epidemic. The American Physical Therapy Association recognizes that physical therapists are uniquely qualified to assume leadership positions in effort to prevent injury and disability, and fully supports the positive roles that physical therapists and PTAs play in the promotion of healthy lifestyles, wellness, and injury prevention. APTA holds as ethically binding the principle that PTs shall endeavor to address the health needs of society. The APTA envisions that by 2020, consumers will have direct access to physical therapists in all environments for patient, client management, prevention, and wellness services. These statements made by the APTA leave no other option but for physical therapists to assume an active role integrating all aspects of disease prevention, health promotion, and wellness into practice. Our company, Metabolic Wellness, equips providers like you with the ability to offer, administer, and market a successful wellness and weight loss program designed by Chris and Heidi Powell. For those of you who aren't familiar, I want to introduce you to Chris and Heidi Powell. They are Phoenix residents. They live here in the Valley. You might have seen them on ABC's Extreme Weight Loss. That's where they gained a lot of their notoriety. They spent 5 seasons there, transforming lots and lots of people's lives, taking off hundreds of pounds. They're both best-selling authors, which is great. Regulars on Good Morning America, Dr. Oz, The View, 2020, Live with Kelly and Michael as well.
Okay, what type of therapists are we looking for? Therapists who fully recognize the impact that excess weight is having on the orthopedic health of their patients. Our therapists understand that when weight is a contributing factor, it must be addressed with as much attention as a resulting orthopedic issue if the best and most sustainable outcomes are going to be achieved. Chance, I want to ask what you might have to add to this.
Yeah, I appreciate it. I think if our therapists understand anything, they must understand that if weight is negatively affecting a patient's orthopedic issue, not equipping that patient with the tools that they need to reduce the weight will leave the patient far short of their potential outcome with a huge risk of reoccurrence as well. So I heard an analogy recently that kind of illustrates this point. It's kind of funny, a little comedic relief to this as well. But I was working with one of our docs and he asked, can you best treat a sunburn at high noon on the beach? And I remember laughing and asking what he meant by that. And he said, that's what it feels like sometimes. If the very thing that's causing the damage is left in play, there's only so much you can do to treat the damage it's causing. And the best thing I could do is remove the sun, or in this case, the weight. But too often the focus is on applying sunscreen or aloe vera. The treatment of the symptom is important, but let us not lose sight of the root of the cause or the root of the issue, which is the weight itself. So I think that kind of brings it all together. We can treat the orthopedic issue, and that is important, and it's paramount. But if we turn a blind eye to what's actually causing that issue, we're just going to leave our patients far short of where they could potentially be if we were to bring the two together with the weight loss and the standard physical therapy treatment. And just as important, if not more important than the type of therapist we're looking for, the type of therapist that we're looking to avoid needs to be clearly defined as well. And any therapist that looks at our program as a means to grow his business, and that's his primary motives to getting into it, probably isn't going to do great with the tools that we provide. So referrals will flow to the therapists who provide our program as a means to increase their level of care for more favorable outcomes. But for those of you who just want to get into this to maybe fill some empty beds, this might not be the right program for you.
Yeah, Chance, I totally agree with that. Just to add, my 2 cents, we've noticed with partners that we've gone in with where the ones who are focused solely on, look, I'm bringing this program in to like you said, fill empty beds or fill the gap of patient inadequacies. We just noticed that the program over time kind of doesn't thrive in that environment. It just kind of survives there. But in order for this to thrive, we've seen partners who have come in and they've done it for the right reasons. They really want to target the root of their patients' concerns, which is oftentimes the excess weight, and the program absolutely thrives in that type of environment.
Yeah, this is a very patient-centric program, and if we can just use it to better the outcomes, I think it can work really, really well, not only for the patient, but also for the provider. Let's talk about how the patient benefits from our program. So something to understand is all of our patients have an orthopedic issue, and they are all great candidates for physical therapy. So physical therapy is something they need anyways. But the difference will be is weight will be contributing to their orthopedic issue in most cases, or at least they have a strong desire to lose weight in conjunction with physical therapy. So they're able to come to our partnered clinics to not only get their orthopedic issue addressed and rehabilitated, but they're also able to lose weight at the same time. And we've, in our experience, we've definitely recognized that this creates better outcomes, quicker outcomes, and definitely lessens the chance of reoccurrence of that orthopedic issue as well. So we feel like it's a win-win for all parties, especially the patient, because they're not having to come out of pocket for this part of the service.
And I think, just to add to that, Chance, I think that one really incredible benefit to the patient is they're getting that in-person accountability, which is really the thing that's missing for a lot of these folks, is they just don't have that accountability. And we see really no better healthcare professional than a physical therapist who understands so much about the human body and can be that compassionate accountability factor for these individuals who so desperately need it. I mean, they're seeing most physical therapy clinics see their patients about 2 to 3 times a week. So that is a major connection point and a huge success tool for what we have integrated into our program.
Yeah, with any weight loss program, information alone typically isn't enough to help somebody make a real lifelong lasting change. So it's information, you got to have the strategy, but you also have that in-person accountability, and that's the role that you play in this program. Richard, can you speak a little bit on how you feel the practice itself benefits? So the physical therapist, the business aspect, how does the practice benefit?
That's a great question. And really, since our inception about 9 years ago, what we have found is when we go into a physician's office, that doctor will oftentimes have multiple, up to 20, sometimes 30 choices for physical therapists. And this is a means to really separate yourself as a physical therapist from the competitors. We know this is a very competitive market. We know one street here in town, in the valley here, there's 6 physical therapists within 1 square mile of each other. And so we know that there's really a competitive market here. And this is one way to separate yourself by offering a solution for this epidemic that's truly impacting 74% of Americans. And so when, as a physician, let's say I'm a referring provider, I know that I can refer to, the physical therapy clinic up the street, or I know that if I refer to you, not only will they get excellent physical therapy treatment, but they're going to have the root of their problem targeted, that excess weight, which is a huge push for me as a provider, knowing that my patient is going to get both things targeted here in a visit.
Yeah, it's definitely a niche market that we're going after, but like Richard stated, it's 75% of Americans who are either overweight or obese. So, if somebody has a back issue, a hip issue, a knee issue, a foot issue, chances are, 75% chances are that weight is contributing to that orthopedic issue. All right, I'd love to give you a little program overview. And before I do, I think it's important to point out that food is a super addictive substance, especially with our patient population. So a lot of times our patients have some pretty deeply rooted poor lifestyle habits as it pertains to food. So if we can look at this more like an addiction, it's going to put us as providers in the right mind state to truly help these folks. It's not as simple as just giving them the right information and asking them to execute it. It's truly bigger than that. It's more of a challenge. So we ask our patients to really adopt one new lifestyle habit at a time. We have 5 that we work off of, kind of our foundational 5, if you will, and we hold them accountable to these choices. So they're provided with a menu of options, 5 different ones that they can select. They're going to select one, and we're going to hold them accountable to that. And once they master it, typically around a week, we're going to ask them to take on one new one after that. So if we do this, repeatedly, one after another, at the end of it, if they have 5 new healthy lifestyle habits that they're now implementing into their life, we're going to be able to change their lives, and we're going to be able to effectively help them to lose weight and keep it off. So, and if they choose to go deeper than those foundational 5, we can go much deeper into the rabbit hole, if you will, with these individuals. The program, there's definitely a lot more to it than these foundational 5, but that's where we start. That's where we see a lot of success. And like I said, there's just more to offer from there. Richard, is there anything that you would like to add to that?
I mentioned it before, but Chance, just to really edify and talk about these points that you're hitting on. You talked about our foundational 5 promises. Just to give you guys an idea, the average diet/weight loss program out there incorporates 12 behavior changes on day 1, hence such poor success rates with people trying to incorporate diets. And I mentioned it before, but one of the most impactful, powerful parts of our program is that you as our physical therapist is providing that in-person friendly accountability, which for the patient is priceless. And especially when it comes to just incorporating one change at a time, really expediting and totally increasing their chances for success.
Could you touch on the statistics of that, of changing one thing at a time as opposed to changing multiple things?
Sure. So we know behavior science has shown time and time again that if we change one thing, one behavior habit at a time, I have about an 80% chance of sticking with it. Yeah. But if I add just one additional behavior change at a time, so now instead of taking on 1, I'm taking on 2 new changes at a time, my chances drop from 80% success down to around 30% success. So you can imagine what this is like for an individual taking on upwards of 12 new changes at a time when they decide that, all right, I'm going to take on a new diet program. You just think of all the different behavior changes that are required to really change a lifestyle. And this is why, over 92% of people who start a program fell within the first 30 days.
Yeah, that's crazy. Thank you for that. One of the main questions, or the biggest questions, most frequently asked questions that we get by therapists who are considering bringing our program in-house is, how much additional time is this going to take me? And the truth of the matter is, it's going to take you a little bit of extra time during that first initial eval, but moving forward from there, it should be just weaved into your normal follow-ups. So during that first appointment, let me tell you a little bit about how that goes. There is a 9-minute and 30-second video that your patient is going to watch. And the reason why we created that video is to really take a lot of the heavy lifting off of your shoulders and put it onto ours. So we're going to guide them through a set of questions, which they're going to be answering along the way. And you'll come in at the end of that. And by you, I just mean a metabolic coach, and that could be a therapist, that could be a PTA, that could be a tech, it could be a front desk person as well. But somebody is going to follow up with them after they've answered these series of questions and just make sure that they understood what they were doing, that they checked all the boxes, if you will. So the video itself takes 9 minutes and 30 seconds, but you can multitask and do other things while they're watching the video. And then it's going to take about 15, maybe up to 20 minutes to just go through these questions that we've already written for you and provided for you after that video. And then, like I said, with the follow-ups, that's not going to take additional time. You're just going to follow up with these patients on their commitments, holding them accountable and things of that nature. Once a week as well, we ask you to weigh and measure the patients. Actually, we measure them once a month. We weigh them weekly, so that might take a couple of extra seconds as well. But beyond that, 20 minutes, extra minutes max during your first appointment, and then from then on, it shouldn't take you any extra time.
All right, I'm excited to share with you one of the coolest parts of our program. I know Chance is excited as well. So we have a downloadable coaching app for all of your patients. This is 100% free, and this is the part where we come in and help you carry the load. This is something that they are going to download in their very first visit with you. It takes a minute to download and goes onto any iPhone or any smartphone. And what it does is it allows us the opportunity to be with the patient on a weekly basis, behind the scenes and remotely. You're with them 2 to 3 times a week in physical therapy, being that in-person accountability. And we've got this app to help support you and support your patient, and it really help to gather their day-to-day activity and generate more powerful results and continue to coach them as they're going through the program. So we're about to show you a little video. Chance, before we show them this video explaining more about the app, do you have any thoughts here?
Yeah, I think it's important to point out, like, you all will be the face of the program. You're that in-person accountability, and which is priceless. Somebody to actually look at these folks in the eye, show them that you care, and being able to hold them accountable to their commitments. That's something that we'll never be able to replace. But in between appointments, like Richard pointed out, we want to be there to support these folks. And if they have questions and questions that you don't know the answer to, they have direct access to us at all times where they can communicate with us and we can support them. And then, of course, they're coming back for their appointments, and we're not going to coach them if they're not coming to their appointments. So that's paramount as well and imperative. But you are the face of the program, and we're just kind of behind the scenes, and we carry a lot of the load so that we can help you along the way.
Now we're in the app. Let's go ahead and look around. The very first thing is it gives you the option to sync with any of your wearable tracking devices, whether you have a Fitbit or a Garmin Connect or anything. I'm not going to show you how to do that now. You can go back and do that later. So right now we're just going to click later. And then we're going to select what we want to track. Now we want to track hydration, we want water, and in our nutrition we want to track our fruits and vegetables, grains, proteins, healthy fats, and starches. And then under activity, you're just going to track anything that you've done or that you do. So I like to run and walk and hike. I also like to do yoga. All right, and then we're also going to track sleep, and then we're going to track our weight. So once you've highlighted all of those, you're going to click done in the upper right corner. All right, so let's go ahead and do some tracking. So for hydration, if I click on the circle that says water, I can put in my servings of water. Okay, I've had 6 servings of water today so far, and if you're curious what a serving is, just click on the servings guide and it'll pop up all the different things for 8 ounces. So a serving is 8 ounces, but it shows you different measurements, and then you can just click on it again and it'll go down. So once you've got your servings, you can just click the check. And then for nutrition, I've had 3 protein today, and if you're wondering what a serving of protein is, click on the servings guide and it shows you your servings there: lean meats, fruits, vegetables, nuts, berries, and leafy greens. All right, I've had 2 fruits, 2 veg, and I've had 2 grains. I've had 1 healthy fat. Okay, so far today. And then activity, I actually walked a bunch today. Actually, back that up. I walked for 60 minutes today. Okay, perfect. All right, sleep last night, got about 7 hours. And then I'm going to go ahead and enter my weight. I'm 150 pounds. And then for your weight, you want to pick 1 day a week and enter your weight in on that day. You could have it be like every Sunday or whatever day works for you, or that whatever day your coach determines is best for you. And then all the other things, the sleep, activity, nutrition, water, those are things you want to enter in every single day. And you can either wait and do it all at the end of the day or do it as you go throughout it, however works for you. But that's how you log. And then if you look at the bottom, the next tab over is your profile. And this shows you what you do. You have a 30-day score that computes it with your hydration, nutrition, activity, and sleep over the past 30 days. And then, so obviously you start at 0 and then you build up as you go. You can also click up here and complete your profile. Actually, why not? I'll do that now. I'm not going to give my date of birth. I'm 5 feet 6 inches. But this is where you can go in and do this kind of thing. All right, and then I'm going to save it. And then X out of it. Okay, on the bottom, the next tab over is your coach tab. So that's where you talk with your coach. So this already says that he's been contacted and he'll reach out to me. I'm going to go ahead and just say, hi, Chris, just so he knows I'm here, I'm excited, I'm ready to get started. I'm going to send that to him. And then the bottom right tab is your community tab. And so you're automatically entered into the metabolic coaching community. And there's a leaderboard here with people who have metabolic scores. So you can see the top 3 here. You can click on view leaderboard and it shows the top 10 people. We're going to back out of that. There's also a community where people can talk about things that are important to them, what they're dealing with, like if there's anything on sale, that, you know, what works, what doesn't work. This is just really your opportunity to contribute to people and be contributed to, okay? And then we're going to go right back down here to our log. And anytime you need to change any of this, you can click options up at the right. It'll take you back there. And then if you want to click on the calendar, over time, it will show you your tracking stuff. So there's today where I've tracked, see how it's in there? So that'll be there and it'll show up. And that really is how you use the app. If you have any questions, you can ask Chris or your coach, or you can email me at info@powellmetabolics.com. Thank you. Bye-bye.
So that's a video that your patients will receive from us, just to outline the app and how it works. And that gives you a good view from the user's perspective. And then on our end, we have a dashboard for each and every one of your patients where we can coach them and monitor their healthy habits and encourage them and communicate with them along the way. So just so you understand, all of your patients will be invited into this service, and we will coach your patients in between appointments and even beyond discharge, 100% free of charge, that comes along with the program. Okay, let's talk about marketing for a second. We have 2 different types of partners, if you will. So we have clinics who already have a field marketer or marketers, and we also have clinics who the provider himself, him or herself, like to get out and market for their location. So if you're already marketing or have marketers, it can make sense for you to market the program yourself. And the alternative is if you don't market yourself, you don't have field marketers, then it might make more sense for you to have us handle the marketing for you. I want to explain some of the fundamental differences between the two. When we're doing the marketing for you, there's obviously a fee assessed. That's one of our biggest expenses is marketing. And also some other difference would be co-branding. If you're going to market this program yourself, you're going to be able to give out flyers, brochures, things of that nature with your logo, our logo, coexisting on one piece. When we do the marketing, we're just marketing our program, and doctors are referring directly to us. And then based off of where the patient lives, works, what type of insurance they have, we distribute the referrals to the best location that best suits the patient. But if you are marketing the program, all the referrals will come in directly to you. So the cool thing is you kind of get in or get out what you put in. Another cool thing about marketing this yourself is that the provider who's sending the referral, or the referral source, is going to get to know and understand you as a business, and not so much just get to know and understand us. So they get to make that personal connection. They understand where their patients are going, who they're going to be meeting with, which I think is a big benefit for you just in growing your business in general. And in marketing this yourself, you have something new to talk about when you go into a referral source. So obviously you've probably been there 10, 20, 30, who knows, 100 times before, but you'll actually have something new and fresh to talk about, which is going to really serve a huge portion of their patient demographic, which I think is great. Richard, is there anything that I left out that you would want to add?
No, really, it's just a reiteration of that last point you were making, and that is having something fresh and really intriguing for the providers and even their staff to hear about, knowing that their patients are going to get this additional amenity service as they send to you for physical therapy. It's a great talking point, and that's probably one of the greatest feedbacks that we've received from clinics who do go out and market themselves.
Sure.
I'd like to talk for just a minute about what we do in respect to our actual marketing efforts. For the clinics that we have partnered here who want us to market for them, and they live locally in the Phoenix area, we have field marketing that we offer. And this entails us going in provider's office, working specifically with work comp groups, corporations, and being out talking with them, letting them know that you exist, that you offer our program. So the field marketing can be a very effective way to help drive patients. The other one is SEO, search engine optimization. We take specific regions. So for example, let's say we have 3 clinics in the Scottsdale area. Each of those regions will have their own specific site, and patients will be driven who are searching on Google for physical therapy, for weight loss. They'll be driven to those specific clinics, and that can help drive as well. And then the last thing that we do quite a bit of is social media marketing, and this is something where we use Facebook a lot. Chris and Heidi Powell have over 1 million followers on social media, and so we like to target their followers. We put together some incredible articles to help drive awareness to what our program is and to make sure we get qualifying candidates. Something that's good for you to understand is that as we send patients in any one of these 3 areas, we make sure first and foremost that patient is fully qualified for the program. They have an orthopedic pain, they have weight that they want to lose, and or diabetes they want to control.
Health insurance.
It's right, yeah. So they have the health insurance that you accept within your clinic. So we do filter these folks to the T, making sure that before they walk in your door, they're qualified. Do you have anything to add to that, Chance?
No, I really don't. I think, yeah, just to reiterate, like with the social media thing, that something really cool that we found with them. They know who we are. They know what the brand is. They're excited about the program. They want to lose weight. They've raised their hand. They've, said, yes, can I be a part of that? So typically arrival rate's going to be better. The adherence is going to be better. Just the outcomes in general are going to be great with the social media marketing that we do.
I'd like to give you an idea of who we've seen success generating doctor referrals with. So here's a list of our top 5 referral sources: family medicine, orthopedics. I will say just briefly about orthopedics that one of the reasons we're working quite a bit with them is because we help patients get optimized and qualified for surgery, especially patients who have a high BMI and they're not currently qualified or optimized for their surgery. Internal medicine, pain management, and work comp. I think it's important for you to understand that these aren't the only groups that we work with, but they're some that we've had some great success with, and we definitely suggest in your promotion of the program that you tap into these types of sources as well.
I know a big question on your mind is probably how much time is this going to take to get me and my staff proficient and get up and running the metabolic wellness program. We do in-person training for your staff, and that could be front desk, that could be a tech, could be a PTA, physical therapists, executives, you name it. We'll train as many people as you like under one roof, and we found the more the better. But we come in and we do a large portion of the training in person, and that typically runs 3, maybe 4 hours in person, and then we like to follow that up with a learning management system, which basically takes everything that you've learned in person, puts it in a digital format. You're able to go through the material again, take quizzes, get certified, things of that nature. So 6 hours max, and that's with the entire training. And then we also have the marketer training. So if you have field marketers or a marketing team, we want to train those individuals how to best spread the word into what you guys are up to. So that could take an hour or two. And also, Richard, will you touch on some of the things that you do to go above and beyond that 1 to 2 hour mark with field marketers?
Something we love to do, in addition to that, like you said, that 1 to 2 hour marketing training, is actually take the marketers out with us as we're promoting the program to the physician groups, so they can see firsthand how this is done.
Yeah, that's great. It works very, very well. Thank you for that. I know you're probably trying to visualize how this is going to work inside your clinic, and I want to, give you a little idea in terms of the patient flow or the patient experience. It all starts with the initial evaluation, and during that eval, either before your portion or after your portion of doing the physical therapy eval, they're going to watch a 9-minute video. Okay, and the reason why we created that video is to do a lot of the heavy lifting for you. So the video is with Chris Powell. He's going to educate them, guide them through a packet that they have with questions that have been drawn up by us, and it's going to guide them through the questions. They're going to write down answers to the question, and at the end of that process, your job is to come in and kind of go through those questions that they've answered with them. From that point, we're going to ask that they get connected with a remote coach via the mobile app. So all of your patients will get access to the app like we've talked about already. And that, again, is to allow us to do a lot of the heavy lifting for you. These patients are going to receive accountability and progressions from in-therapy coaches during follow-ups, and that's you. So as they come back, you're simply asking them, how's it going with this commitment or that commitment, to be that in-person accountability with them. At a certain point, you're going to discharge them because their orthopedic issue is going to be at a place where they can go. And then after that point, we continue to coach them through the app. So as long as they are staying engaged with the app, we're going to stay engaged with them, and we're going to continue to coach them. We're going to help them to lose even more weight so that we can bring those results back to the provider that referred them in the first place. And of course, we're going to give you all the credit for that in the process.
As the health of our nation crumbles because of the explosion of chronic disease related to obesity, most providers aren't willing to take a stand to help those who need appropriate guidance. Health professionals seem to be pointing fingers at one another saying, "It's not my job, it's someone else's responsibility." The APTA states that physical therapists shall endeavor to address the health needs of society, and Metabolic Wellness puts the tools in your hands to do so.
Like I stated earlier, there's some quotes that we've found over the years that we absolutely love, and this is one of them, and I'm going to read it for you. As we move forward, our profession must be prepared to address our patients' health needs by not only addressing their rehab needs related to function for diagnoses such as low back pain, knee osteoarthritis, or a sprained ankle, but be ready to address the whole person in terms of their health, fitness, and wellness. The APTA envisions that by 2020, consumers will have direct access to physical therapists in all environments for patient, client management, prevention, and wellness services. Plan to be a beacon of hope for your patient who is often overwhelmed by obesity, disease, and despair.
On behalf of Metabolic Wellness, it's been a pleasure to be with you all today. If you have any questions about the program, please don't hesitate to give me a call, or you can email me. And if you'd like a quote for your business specifically, we'd love to help you with that as well. You might have a lot of questions about what this is going to cost, and this is something that we'd love to help you put together. Now, there's several variables to take into consideration when building your quote out, such as the number of clinics you have, how many providers you have, whether or not you're going to do the self-marketing. And so, like I said, there's some things to take in consideration, but if you are interested, please reach out and we'll take it from here. We look forward to hearing from you.
Thank you guys so much.